Students, in this video we will discuss 25 important MCQs which are most important for exam point of view. Question is an example for a drug that induces cytochrome P450. Options are phenytoin, omeprazole, allopurinol, chloramphenicol. Answer is A, phenytoin. Next question. G protein coupled receptor comes under. Options are metabotropic receptors, ionic receptors, nuclear receptors, kinase linked receptors. Answer is A, metabotropic receptors. Next question, which of the following phase 1 and phase 2 reactions are the most common drug biotransformation reactions respectively? Options are oxidation and glucuronidation, reduction and acetylation, hydrolysis and glucuronidation, oxidation and glutathione conjugation. Answer is A, oxidation and glucuronidation. Next question, absorption of drug is affected by. Options are solubility, route of drug administration, vascularity, all of these. Answer is D, all of these. Absorption of drug is affected by solubility, route of drug administration, vascularity. Next question, the enzyme that is responsible for the conversion of ATP to CMP is. Conversion of ATP, it means adenosine triphosphate to cyclic adenosine monophosphate. Answer is A, adenylyl cyclase. Next question, pharmacodynamics involves the study of following. Options are mechanism of drug action, biotransformation of drugs in organism, distribution of drug in organism, excretion of drug from organism. Pharmacodynamics mechanism of drug action. Next question, the discipline which deals with the effect of the drug on the body is. Options are pharmaceutical, pharmacokinetics, pharmacodynamics, toxicokinetic. Answer is C, pharmacodynamics. Drug on the body is pharmacodynamics. D. Next question, non-competitive enzyme inhibitor is. Options are allopurinol, carbidopa, physostigmine, acetazolamide. Answer is D, acetazolamide. Non-competitive enzyme inhibitor is acetazolamide. Next question, the phenomenon of repeated administration of drug resulting in cell receptor blockage is known repeated trachyphylaxis, idiosyncrasy, synergism, tolerance. Answer is A, trachyphylaxis. Next question, synergistic effects refers to. Options are the effect of one drug is increased upon concomitant administration of other. The effect of one drug is increased upon concomitant administration of other. The effect of one drug is decreased upon concomitant administration of another drug. One drug does not produce its effect until the other one has been excreted drug. One drug nullifies the effect of another drug. Answer is A, the effect of one drug is increased upon concomitant administration of other. Next question, when procaine and adrenaline are given in a combinational form, the duration of action of procaine is increased. The phenomenon is known as. Options are additive effect, synergism, idiosyncrasy, tachyphylaxis. Answer is B, synergism. Most important and most repeated question. Next question, a drug that decreases the activity of another drug is called as antagonist, agonist, adverse reaction, synergistic. Question was, the drug that decreases the activity of another drug is called antagonist, agonist, adverse reaction, synergic. Answer is A, antagonist. These terms are most important. Antagonist, agonist, synergistic, trachyphylaxis, idiosyncrasy, most important terms that should be remembered. Next question, chemical changes of the drug in a living body are referred to as, options are digestion, biotransformation, absorption, radiation. Answer is B, biotransformation. The chemical changes of the drug in a living body are referred to as biotransformation. Next question, the substance binding to one receptor subtype as an agonist and to another as an antagonist is called as, the substance binding to one receptor subtype as an agonist and to another as an antagonist is called competitive antagonist, irreversible antagonist, agonist antagonist, partial agonist. Answer is C, agonist antagonist. Next question, what term is used to describe a decrease in responsiveness to a drug which develops in a few minutes? What term is used to describe a decrease in responsiveness to a drug which develops in a few minutes? Options are refractoriness, cumulative effect, tolerance, tachyphylaxis. Answer is D, tachyphylaxis. Next question, what does the term potentiation mean? Options are cumulative ability of drug, hypersensitivity to a drug, fast tolerance developing, intensive increase of drug effects due to their combination. What does potentiation mean? Answer is D, intensive increase of drug effects due to their combination is called potentiation. Next question, agonist combine with receptor to produce physical action, chemical reaction, pharmacological action, neutralization. Agonist combine with receptor to produce physical action, chemical reaction, pharmacological action, neutralization. Answer is C, pharmacological action. Next question, stimulation is a type of options are adverse reaction, irritation, drug action, modification. Stimulation, answer is C, stimulation is a type of drug action. Next question, a drug which activates a receptor to produce an effect in the opposite direction to that of a well recognized agonist is called, options are partial agonist, antagonist, superagonist, inverse agonist. Answer is D, inverse agonist. A drug which activates a receptor to produce an effect in the opposite direction to that of a well recognized agonist is called inverse agonist. Next question, when a drug binds to a silent receptor, options are no pharmacological response occurs, the drug gets metabolized, neuroendocrine hormones get released, DNA changes occur. Answer is A, no pharmacological response occurs. Next question, which of the drug combinations are synergistic? That synergistic effect means, a synergistic effect occurs when two or more drugs work together to produce a greater effect than if they taken separately. Options are ciprofloxacin, theophylline, probenecid, penicillin. Penicillin aminoglycoside, all of these. Answer is B. Probenecid penicillin. Probenecid is a drug that sometimes taken with penicillin to increase the amount of penicillin in the blood. And CSF. Next question. Toxic effects of a drug at usual therapeutic doses are called. Options are intolerance, secondary effect, idiosyncrasy, hypersensitivity. Toxic effects of drug at usual therapeutic doses are called secondary effect. Next question. G protein coupled receptor is, options are a bundle of 5 alpha helical, a bundle of 6 alpha helices, as a bundle of 4 alpha helices, a bundle of 7 alpha helices. Answer is D, a bundle of 7 alpha helices. Next question. What are the protein structures called that are expressed within the cell membranes and interact with endogenous signaling molecules or some drugs to initiate an intracellular response? Options are enzymes, receptors, hormones, ligands. Answer is B, receptors. What are the protein structure called that are expressed within the cell membranes and interact with endogenous signaling molecules or some drugs to initiate an intracellular response is called receptors. Next question. Which of the following statement explains receptor affinity? It is half of the dose needed for maximal response. It is measure of how tightly a ligand binds to a receptor with the maximum response downstream of a receptor. It is the concentration of ligand that causes effects. Answer is B. It is a measure of how tightly a ligand binds to a receptor. These 25 questions are most important for exam point of view. This video will continue. Thank you.